Some people say the silent P in psychiatry stands for pain and perception. So when you think about that, psychiatry is all about perception. We think about the brain as the organ that controls feelings, thoughts, and behaviors. And addiction is a behavior. So this is a person looking sideways. But what you can see is sight, smell, taste, touch, and hearing. Those are 5 of our senses. And those senses, or those perceptions, all feed in to a very powerful part of our brain. And that part, as you can see this red line in the middle that's connected to the heart, is the heart of the brain. This is the part of the brain called the limbic system. And the limbic system is the part of the brain that is all about fight, flight, freeze, love, and hate. And if I was to do a heartbeat right now, dum 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 dum. You can feel the intensity of the moment because I just, through your auditory canal, through your hearing, you're conditioned to hear that heartbeat and know that that means something is happening. So your brain automatically goes into a fight or flight phase, but it also goes into a love or hate phase. Now, some people think love is controlled by the heart, and where am I going with this? This limbic system is so important that this is where all substances of abuse target. They grab a hold of this limbic system through a brain chemical called dopamine, and they send your dopamine flying. So if you're experiencing pain, how many people in here have experienced pain? How many people in here have taken a pain reliever? And remember that moment when the pain relief happened and you said, and that feeling is because your pain receptors were blocked, not because the pain stopped. The pain was still sending its signals to your brain, but there was a block. And that block caused you not to perceive the pain. That's what opioids do. They allow you to no longer perceive the pain. The second part of the brain, the cortex, is regulated by serotonin. And the third part of the brain is representing our frontal lobe. And the frontal lobe is the last part of the brain to be developed. It's actually not finished developing until about age 25. It's the part of the brain that controls our executive functioning. It's our, I like to say, MD part of the brain. It makes decisions. Okay? So when a person is addicted at that very core limbic system level, it's as if they are in love with the opioid, okay? Because again, you see how I have it connected to their heart. So when we have loved ones and we see them going down this path of addiction, we try everything we can to get them to make different choices. But at that point in the addiction, it's, I don't want to say impossible, but their brain chemistry has been hijacked. Okay? All of us, and this is how we demystify the brain, all of us are susceptible to being addicted to something. Now the challenge is the something you're addicted to healthy or unhealthy? Okay? So there is something called stress. And there's healthy stress and unhealthy stress. Here's an example, Christmas. Is it a healthy stress or unhealthy stress? Is it distress or eustress? So distress is unhealthy stress and eustress is healthy stress. And we actually have words for it. We don't have those words for pain. But there is something called healthy pain. Pain actually is there to teach us. It's there to let us know when something's going wrong. It's not there to tell us, oh, pop a pill, make it go away. Okay, run the marathon, keep on running on your broken ankle. Keep on going through the football game. Just because you got an injury, don't matter. Just pop another pill. That is not what it's there for. Pain is there to teach us something. But we've gotten so used to not wanting to feel pain. I don't want a pain-free life. There is no such thing. It doesn't exist. Going to medical school, it was painful. It was painful to get in. It was painful to study. It's painful to dictate my patient's notes at the end of the day. It's painful. But the other part of it that's pleasurable is providing care to patients. I love that part of what I do. So we have to understand that this perception of pain, there's painful pain and unhealthy pain, but there's also healthy pain. We've got to teach our kids. After a surgical procedure, a tooth extraction or a oral, you don't need really at the third day, your perception of pain ought to be going down. The amount of medicine you're taking ought to be going down. If it's not, guess what? Make that phone call. Call the nurse, call the doctor, call the clinic. Yeah, it's embarrassing for them to say, oh, it'll go away in a couple more days. Give it a couple more days. You say, okay, cut that medicine in half. Because by day 5, you're starting to have tolerance develop. And if you're requiring the same amount of pain medicine that you did on day 1, guess what? That's called tolerance. And tolerance is the first step to addiction. Okay? So I'm doing the brain chemistry thing because I want us to demystify the brain. And I want us to realize that each and every one of us is susceptible to an addiction. Is it healthy or unhealthy? Okay? And if we can at least identify our own addictions, our own passions, our own loves, then maybe we can stop being so judgmental about people who have unhealthy ones. And then we can help to move them towards something that's healthier. And we have to know that this is what our community needs. What we know about opiates is that it's not necessarily the amount of opiate that kills the person. It's using in an unfamiliar place because their brain chemistry changes. The perception of how much they use with that novel stimulation changes, and it actually kills people. Same amount that they've always used, but just using in a different place. So I hope that has been a little bit of information. There is hope, but it has to be us. It has to be us.